Hi, and welcome back. In this video, I'm going to talk about fasciculations, what they look like clinically, their clinical significance, pathophysiology, and what they look like when they occur during a needle EMG examination. A fasciculation potential is defined as the visible spontaneous contraction of a small portion of a muscle. Importantly, fasciculations are not under voluntary control. Typically, the number of contracting muscle fibers is so small that they do not cause any visible movement of the joint. Fasciculations appear suddenly and briefly, and you are more likely to notice them in your peripheral vision as you are examining the patient. We call them fasciculations when we notice them clinically, or fasciculation potentials when doing a needle EMG. This is a typical example of fasciculations in the calf muscles. Notice how brief and isolated these contractions occur. Whenever you think you see one, you turn your eyes, but it's already gone. A typical fasciculation potential lasts only several milliseconds. In this example, fasciculations are extremely abundant and can be seen in several muscles of the upper arm. They're easier to see because they appear more frequently, but in this case the motor units are probably also enlarged due to a neurodegenerative process. This means that a larger number of muscle fibers are contracting simultaneously, leading to a more pronounced, more visible movement. Fasciculations can occur in any disease that affects the motor neuron, including radiculopathies, plexopathies, and neuropathies. However, they are most commonly associated with ALS, a disease in which they can be quite prominent. In fact, fasciculations are featured in the Gold Coast criteria for ALS, in which they can be considered as evidence of ongoing denervation. However, it's extremely important to note that they are a highly unspecific finding. They can be seen in healthy subjects, for instance after heavy exercise or drinking too much coffee. Therefore, without progressive muscle weakness, atrophy, and upper motor neuron signs, there is no need to be afraid that someone has ALS purely based on the presence of fasciculations. We don't know exactly how fasciculations come about, but it's clear that they arise in the motor neuron and are probably a sign of some sort of motor neuron hyperexcitability. Because they arise in a motor neuron, their morphology is exactly the same as that of a motor unit potential. A main difference with motor unit potentials is that they are not under voluntary control, so they appear spontaneously and singularly, in contrast to the rhythmic firing rate of normal motor unit potentials. In the next slides, I'll show you some examples of EMG traces containing fasciculation potentials. That is all for now. I hope that this video will help you recognize fasciculations in the future. Don't forget to like and subscribe to this channel if you thought that these videos are useful. If you have any questions or requests, don't hesitate to leave a comment below this video. See you next time.